Hi, everybody. My name is Colton. Welcome to the Nurse Converse podcast. I am super excited that you're all here today. I have a pretty interesting topic that I think really any nurse can benefit from listening to this conversation. I think whether you're a new grad nurse or you've been a nurse for a couple of years, or even if you're in nursing school or you're a seasoned nurse and you've been doing this for a very long time, I think we all can benefit from hearing this sort of conversation that I plan on having with you today. So the topic of this episode is going to be how can we use our license and the skills that we have and transfer that into other aspects of our life that are not in the traditional hospital work. I think as nurses, we so often get ourselves stuck in this mindset that we have to work in the hospital or we have to be working in the emergency department or the ICU. And that's where we get our worthiness from when it comes to being a nurse. But what I have learned through my experience is that this is just not the case. There are so many skills that we learn, there are so many things that we experience and people that we meet through our time as nurses that we really have so many opportunities that we close ourselves off to because we're stuck with this narrow lane that we've been told that we must follow in order to be a real nurse. And so I wanted to unpack that and just talk about the ways that maybe we can get out of this old fashioned mindset of being a nurse and working in a hospital. Because even, in today's day, with social media and all the things that are out there in the world, there's so many different options that we have. So let's dive into it. First off, regardless of, like I said, if you're a new grad in nursing school or a seasoned nurse, just take a moment to just be proud of yourself. To be a nurse, to take the initiative to go out there and to obtain a degree and go through the nursing programs, like it is difficult and we all know how hard it is. And even if you're going to school right now, you are witnessing firsthand how difficult and how strenuous these programs are. And it takes every ounce of you just to get through each day. I remember being in nursing school and just it was so tough. Like I worked as a server, I worked in a restaurant, I worked at Outback Steakhouse and Texas Roadhouse. Those were my two jobs that I kind of worked at during nursing school. And I just remember being in school and working and feeling like I was never going to get through it. I felt like there was no end in sight. Like it was just like this constant hamster wheel and cycle of just torture because it's difficult. So if you made it through, or if you're making it through right now, just take a moment and realize how hard that was and how what a small percentage of the population actually goes through that kind of training and strenuous education, and just use that as like a little light that you can give yourself that proves that you can really do hard things. And even if you don't give yourself enough credit, just getting through that alone is something to be proud of. So let me take you back a little bit. I went to nursing school at Northern Arizona University in Flagstaff, Arizona. I loved my experience there. That's where I had amazing professors. I met some like my most close and best friends to this day going through that nursing program. And the reason that I bring this up is because the people that I went to school with, I don't remember them for the type of nurses that they are, or I didn't become friends with them because they were the smartest in class, or I felt like they had amazing skills as a nurse. It was the people that they were on the inside and the people that they were when we were hanging out outside of school. Like we created a bond, yes, through going through this program together, but we kept that bond because of the people that we were. And that's the whole impetus of this episode, is focusing on the people that we are and the humanness that's inside of us, not this nursing license that a lot of us tie our identity to. And we'll get to that a little bit later in the episode, is how we tie our identity. And once we become a nurse or we get into the program, like nursing becomes such a vital part of our identity, and it can actually be very detrimental. And I think that even for me, I experienced this a lot, where there was times in my life I remember telling myself like, well, I may be going through this thing, but at least I have this career and like I have nursing. And it was almost like this just like toxic relationship that I had with being a nurse. And when you would meet new people, or I would be in like a social gathering, like that would be one of the first thing people would want to know is, oh, like what's the worst thing that you've seen somebody coming into the emergency room with? And for me, it's like, I don't really, that's not me. Like, I guess I'm a nurse and it's what I do for work. There's things that I'm passionate about in nursing, but like, that's not me at my core. Like, there's so much more to me. There's so many more layers than showing up and just being a registered nurse, whether you work in the ICU or the emergency department. Like there's so much more to us as humans. And so I think what I'm trying to emphasize here is not getting lost in the title of being a nurse and not letting that be like your full identity. And so going back to my nursing program, again, I had some amazing professors. There's some that I still keep in contact with on via social media or I have their personal phone numbers. But what I remember most is we were fed information that pretty much said, here are your options to be a nurse. These are the specialties you can go into. These are all pretty much hospital based with the very few things that we touched on as far as like home health or working at like a inpatient psychiatric center. Like everything was patient care based, which in a sense I get it. You have to learn, you have to get a foundation. And when you are going to be a nurse, most people go work in the hospital. So these programs are set up to get you ready and prepare you as best they can to go work in a hospital setting. And that's what they do. But I remember always kind of feeling this just like there was always something missing. Like I always felt like there was something else out there for me. And I think that that's important to touch on because I don't know about you, but I want to experience as much from this life as I possibly can. And for some, like this all looks so different for us. Like if you are going to nursing school or you're a nurse and the hospital is your goal and you want to work in these like intensive care units or in the emergency departments or the med surge units or labor and delivery, and it's like that is your passion and you just want to do that, then do it. Like there's nothing wrong with that. There's nothing wrong with wanting to go the traditional nursing route. But I think I speak for a lot of us when I say that there's just something there. There's something missing. And I felt this way. I've been a nurse now for about 5 to 6 years. And for the last probably 2 years, I started to just like feel like something's not there, like something is missing. And again, I had tied so much of myself to this identity of I work in the emergency department and like that's just like who I am, that I had to like kind of take a few steps back. That's when I started to realize like, oh, like maybe that's not actually like what I want at my core. Like maybe that was something I was tying the title of being an ER nurse, like I was giving that so much credibility and so much worth that that is what I was holding on to. And it wasn't something that I actually wanted to do. It was something that I honor. Like I felt what was honorable that other people could do. And I was like, I want to do that. Like I want to be in the traumas. I want to be in there. I want to be able to experience these things and to like have these skills and tools. And while I think that's amazing and great, and I have gained those tools and the knowledge to work as an emergency department nurse, I just felt myself not fulfilled. And I think especially working through COVID, a lot of nurses started to feel burnout. And I don't want to sit here and have a whole episode on burnout because I think that's such a buzzword and hot topic, especially in the nursing community. But it's so, so, so real and it's relevant, especially during COVID. A lot of us felt that just burnout, like we were working like twice as hard. We had, less staff. The patients were twice as sick and the conditions were just horrible. And I think after the pandemic kind of smoothed out, a lot of these feelings started to come up for a lot of people because it made us take a step back, look in the mirror, and just really take a look at our life because we were faced with so much death. And so it made us think, is this really what I want? It gave me at least that moment to look inward and feel how my body was feeling when I was at work. When I would get to the emergency department, when I would be at these shifts, I would not feel good. I would feel like I was almost having an out of body experience. Like I was up here looking down on my body and I was just going through the motions. And I let myself do this for so long. And I got to a really, really dark place. And I think that's why I'm so passionate about sharing this information because I know that there's people out there that are also struggling with this idea of like, how do I transition out of this traditional nursing role because this is all we know. And I made this joke the other day. I was talking to a friend and I was like, nursing's it's almost cult like. And I say that with humor. But it really is kind of like a cult in the sense that once you're in, it's really hard to get out because you start looking, you've made a lot of friends, you have a community, and most of those friends and community are nurse based. And so then you start thinking, okay, if I decide to leave or I decide to, go down this other route, is that going to change how people look at me? Is that going to change my worthiness? Is that going to change the way that I feel about myself? And all these fears start to come up like, am I going to lose my skills? Am I going to lose my knowledge? Like, am I going to regret this later? And really, the only answer to that is I don't know. I don't know if this is the right answer to leave this traditional job that I've been working for the last 4, 5, 6 years and try something else. But so far, I have learned it's a balancing act. I was working in the emergency department during COVID. Was in Arizona. I started travel nursing like a lot of people did and ended up on the East Coast. So I live in Boston. I have been at a few hospitals in New England. And during that time, I burned out. I worked a lot. I would take these contracts because this is what the system does. The system will dangle these high paying contracts in your face, but then you realize, oh, I have to work 48 to 60 hours to get that money. And so I did. I did what a lot of people did because it was more money than a lot of nurses had ever seen. And so during that span of time, I just worked and worked and worked and worked and worked. And I lost myself in that. I totally gave myself to the system. I gave myself to these hospitals and I lost myself. And when I was able to reel that in a little bit, it's actually pretty crazy how much I changed my outlook on where I want to go in my life. And I started allowing myself to think of other ventures that might fill my cup or might interest me. I have this like burning desire to start a business and to be more in like a creator artistic realm. Like I started a podcast. If you want to check it out, it's called the Mile 17 Podcast. I have it on Spotify, Apple, and YouTube. So you can go check it out. I have started writing a book. I just have all these big ideas that I've started to actually bring to fruition. And I say these things not to brag or anything like that, but just to, because trust me, they're at the very early stages. Like there's really nothing to brag about, but just to give you an idea and maybe plant the seed in your own heart and soul and brain that there are other options for you. And it's not that I just like quit nursing. I've just started to transition my life to where I have options. And you're not going to know what you like to do until you just start doing things. And this is something that I also think is very important to touch on, is like you may be going to nursing school and you have this like dream and goal. Like I want to be in the ICU. Like I want to work in the surgical and trauma ICU in the inner city hospitals. Like this is what I want. And then you get there and it's not what you thought it would be. You work, it's always going to be hard at first. And I always tell people there's always a big question with new grad nurses, especially, is like, how long do I stay in this job if I don't like it? And I think a really good base is give it 6 months, because everything sucks at first. It's terrible to be new and uncomfortable. Like you're not going to like it at first. But if you give it some time and it's been 6 to 8 months and you're still just like dreading it every day, it's taking a toll on your mental health, you're having so much anxiety, maybe it's time to start looking elsewhere. And maybe, again, we tie so much meaning to these things. Like we tie so much meaning to that dream job that when you get there and it's not what you thought it would be, it's disappointing and it's hard to leave. And I think if you could honor those parts of you and you can honor those feelings and you can just be like, you know what, I gave it my best shot. I'm going to go try this. I think it's beautiful. It's better than staying somewhere that you can't stand. It's like a bad marriage. If you're in this marriage that is not good for you and you just keep showing up every single day, at some point you have to realize like this is not working for me. This is not working for you. Like we need to go our separate ways. It's the same thing with these jobs. Like you can give it your all and you can try to change some things. And like, yes, there are times where maybe like things suck and you just keep trying and keep showing up and it changes. Maybe you have some different coworkers come, or you just get more comfortable and more confident in your skills and then you start to like it. And that's great. But if it's not changing and you're still not happy, leave. Like, don't stay stuck. And so for me, what I've done as far as my nursing jobs go right now, I'm working per diem in an emergency department with pretty low requirements just to keep my feet wet, because I wasn't fully ready to just like pull the plug and get out of there. So I'm still doing that. I have a per diem job doing IVs, which is kind of like a med spa. And that's like a fun job. I enjoy doing that. And then my other job, which is part time, which is kind of how I'm paying my bills, is more of an administrative role. And so I have all these different things. And yes, it sometimes gives me a little bit too much of a busy schedule, but I'm just trying new things. And like I said, I have the podcast, I'm writing a book, and eventually I'm going to be starting my own business. So there's all these things, all these ideas. And I think the more doors that you can open and more opportunities that you give yourself, the better. I know some of you may know me from the Nurse Daddies. Yes, I am Daddy Colton from the Nurse Daddies on Instagram and TikTok. And if something like that, even like if social media is something that you have been thinking about, but you're like scared to put yourself out there or you just don't know, try it. Because if you don't try it, then you really don't know. And I think that's what keeps all of us stuck. Is like we're all afraid. There's so much fear. We're like, oh my God, I'm going to fail, or people are going to think X, Y, and Z about me. Let them think that about you. Because when you start to honor yourself and you start to do the things that you actually love and you show up for yourself, your body will feel it. You will show up differently, and it will flood into every other aspect of your life. And you owe that to yourself. Like you are a nurse. Like you have done all these different things to care for other people. You've been so selfless. And I think a lot of us forget that, and we get this message of like, this is the career you're going into. You are giving yourself to other people, you are in service to other people. And while I think that's so amazing and great and important, you also have to put yourself first. You have to be in service to yourself. And if you're not filling up your own cup, then you have nothing to give to other people. And I think that's how that old saying goes, like, you can't pour from an empty cup. And so if you're just showing up to this job every day and it's just taking the life out of you and it's sucking your soul dry, then what do you have to give to the rest of the world and to your relationships and to your health? Okay, so I kind of touched on this already, but you are not a nurse. Nursing is what you do. And I know that even probably in this episode, I've said things like, you're a nurse, you're a nurse. You're not a nurse. Nursing is what you do. Nursing is a part of you. Nursing is how you pay your bills. Even if nursing is a passion for you and you love your job at whatever you're doing, it's not who you are. There's so much more to you. When you start to peel back the layers of yourself. Like you're a mom, you're a husband, you're a cousin, you are a dad, you're a son, you're a daughter. There are so many other things to you. Like you're a CrossFitter, you run marathons, you are a sewer. Like there are so many aspects of you that if you just like tie yourself to a nurse, you close yourself off to so many amazing things in this world. So that's the first thing I wanted to really emphasize to you is be careful how you identify yourself. You are not a nurse. Nursing is something that you do. The next thing that I wanted to touch on is define your why. Why are you a nurse? Why are you again, I know it's kind of like yes, it's all like semantics with the language that we use, but why are you in nursing? Why is this something that you chose to do? Why do you show up every day and go to the gym? Like you have to define why you're doing something in order to fully feel that thing. And when you can start to define the most important things in your life and define what you want, that is how you get the direction that you want to go. That is how you start moving towards this thing. So let's take, for example, let's say you really do want to be an emergency department nurse. Like it is like this goal of yours. You were like dying to get out of the emergency department. You've been working on a med surg unit for the last 2 years, and you've just been waiting for like that right time to go down to the emergency department. This is my first bit of advice about this. Why? Why do you want to go to the emergency department? Do you want to go down there because it looks cool to like be able to be like, oh yeah, I'm an emergency room nurse. Like here's all my trauma and traumatic stories that I have dealt with that I can now dump on you. Like, why do you want to go down there? Like, do you truly want that experience? Like, do you truly love the way that the emergency department flows? Do you want the faster pace of kind of dealing with patients acutely and then moving them on? Like, what is it that you want to go down to the emergency department for? I think if I had asked myself this back when I started as a nurse, because that was me, I was on a med surg unit for about a year and a half, and I wanted to go to the emergency department. And I think that if I had actually sat and asked myself why, if I had the words and the wherewithal to ask myself why I was going down there, I probably wouldn't have ever gone. I probably would have decided, I actually don't want that. And I think I was one of those people that was like, oh, it's going to be so cool to be working in the ER. Like, I'm going to have all these cool stories. Like, people are going to think that I'm like, you know, this cool nurse that knows all these things. And I think that if I had been real with myself, it would have been more of like, it's actually not something that I'm like dying to go do. Now, do I regret going to the emergency department? No, I have gained so much from it. I don't think that it was the wrong choice. I think that I have really gained a ton of perspective and experience and life through working in the emergency department. I have met so many incredible people, and there really are so many skills and knowledge that I have obtained just by working in emergency departments around the country. So I don't regret that. But the point I'm trying to make is like, if you can just define those like why moments for you, it just gives you so much more clarity on where you're going. Why do you want to do that? Because a lot of us don't take the time to just be like, why? Why am I doing this? And I think that goes for a lot of different things in our life, not just being a nurse. If we can define why we are wanting certain things, it makes it so much more powerful too. And sometimes it helps you to clarify, okay, is that just an admiration that I think I like in somebody else that I admire they're doing, or is that something that I actually want to do? All right, this is the big one. Who are you without a nursing license? I don't know if anybody's ever asked you this before, but who are you if that nursing license was to be stripped away? If you no longer had the letters RN after your name or LPN or whatever letters come after your name, because you know there's a million different variations of letters to describe who we are. If that was gone, who are you? Who are you at your core? I want you to honestly to get out a journal, and whenever this episode is done, get out a journal and answer these questions that I'm asking you. Define your why, and then ask yourself who you are. Who am I without this license? Like, am I loving? Am I caring? Am I kind? Like, what do I love to do? Do I love to go on hikes? Do I love to take my dogs out for a walk? Do I love to go to CrossFit? Okay, I've mentioned CrossFit twice. Yes, I do go to CrossFit. Do I enjoy snowboarding or skiing? Do I love to go volunteer at the local shelter and help those people? Or do I like to be able to go to Alcohol Anonymous meetings, even though I'm not an alcoholic, and just like give my advice or like listen to these people and help them through because it means something to me? Like, who are you? If you can define those things, it just, like I said, like this all goes back to clarity. It gives you so much clarity on the things that you're doing in your life and the decisions that you're making. And when you start to define these things and you start to understand yourself a little bit better, then you need to move on to things like self-care. Like, what are you doing for your self-care? And this also is kind of like another little buzzword, but something I've learned through therapy is we have to have these self-care times. Like, we have to take care of ourselves, especially when we're working in the hospitals. Like, what are you doing when you're not there to ensure that you're taking care of yourself? I'll give you kind of examples of what I do. I need to work out. I love to work out. So I'll mention it again. I go to CrossFit. It's something that I am very passionate about. I run. I ran the Boston Marathon last year, and that's actually how I was inspired. That's what inspired me to create my podcast, Mile 17. I am signed up for another marathon in Honolulu at the end of the year. I have two dogs that I absolutely love to take out. I am married. Me and my husband love to travel. Like, there are so many things that I love to do. And I think even like when I'm talking about this, you can probably just like, if you're watching on video, you can see my face light up when I talk about the things that I love to do. I love breakfast. I make breakfast every single day. And I cannot wait until I get up in the morning. I can make my breakfast for me and my husband, and then we can have some coffee together. It is like a sacred time. I look forward to it every single day. So if you can just like find these self-care moments for you, and like it doesn't have to be something that you're out spending money. I think a lot of us get this idea that like self-care is a manicure, a pedicure, or going shopping. And while these things can be a self-care modality, I think that there's more to like our daily lives and what we're choosing to do with our bodies and our health and the people that we love, that doesn't necessarily cost money, that is considered self-care. Relaxing on the couch for a couple hours is self-care. So I think you need to define those things for yourself. And this all goes back to like who we are at our core, and the things that we love to do unlock so many things for you. It gives you clarity on what direction you want to go with your career, how you want to feel inside your body every day. Like, we have to go back to the basics and like look inside of ourselves and really feel what is most important to us. A way that I really get off course and I start to really feel terrible inside my body. And I've currently, honestly, if I'm being totally honest with you, I've been going through this recently to where like I'm waking up and I'm not feeling great. And I find myself getting off course with what is most important to me. And I start not sleeping well and not being as consistent in the gym. And I'll tell you why. Because I am so guilty of being stuck in the golden handcuffs. I will tie this kind of back into COVID because when I started taking these high paying contracts during COVID, I started to set my expectations that high. And so then, when the rate started to drop, I started to panic because not that I like totally adjusted my life to those rates, but I was like, oh my God, like I've been making this much money. I need to keep making that. And so let me tell you, I have completely wiped myself out trying to keep up that pace. I just literally told you that I'm working 3 different jobs. And while it might sound great to have like these just per diem jobs and like make kind of your own schedule, while it's amazing on one end, the other end is you have to be able to have the self control to not overwork yourself. And I do that. I overwork myself. In the last 2 to 3 weeks, I've probably had a total of like 2 days off. And I don't say that as a badge of honor. Overworking yourself is not a badge of honor. And I have had to unlearn that tremendously. It has been something that I have really had to unpack. Like I told you, I'm going to therapy. I've really had to unpack that. Something that I learned as a child through watching my parents and just like the people in the town that I grew up in was like, you work yourself to the bone and you just keep going from there. And while sometimes in our life it is you're able to do that. It's important. You're trying to pay something off or you're trying to go on vacation. When you're living your life like that, week after week after week, it turns into months, then it turns into years. You're neglecting your health and you will start to feel that. And anyone listening, like what I'm trying to get you to understand is like, there are so many nurses that get to the end of their career and then they're unhealthy and they don't have the health and the stamina and the energy to enjoy the fruits of their labor. Like they've just given themselves to this hospital system, to the healthcare system for so long, and they now don't have the energy or the health to enjoy whether they built some wealth or they now get to retire. And that doesn't have to be you. That doesn't have to be us. We can take control of our license today. We are allowed to go outside the box. You don't have to stay in the hospital and work in the ER, in the ICU, in med surg, in labor and delivery. There are so many non traditional ways to use your license. And something that I really want to kind of wrap this episode up with is to tell you it is okay if you decide this is not for you. If you are a nurse and you get to a point where you're like, man, like I need a break from healthcare, or I'm thinking about leaving the bedside and starting my own business, or I really want to try this other job, or maybe you want to go back to school and do something that's not healthcare related. You are allowed to do that. And it does not make you any less of a person. It does not make you any less of a nurse. You are still a real nurse if you are not working in the hospital. So I know that somebody out there needs to hear that, and somebody needs validated in that, and somebody needed permission to get out of this job that's been sucking their soul. If you are working somewhere that is detrimental to your health and you wake up every day and you're anxious and you're dreadful and it's taking a toll on your health, get out. You do not have to do it. And this goes for, I'm also very passionate about, I can go on for days about this. If you're working night shift, and again, it's something that like is just so bad for you, find a way out. There are ways around working night shift. I can tell you that because I have never had to work a full-time night shift in my life. I have done it here and there. When I was in nursing school for a very short time, I had a night shift position as a CNA. I learned very quickly it was not for me. I'm not a night shift person. Some people thrive on it. Some people love it. You do you, boo boo. It is not for me. And it was not okay for my health, my mental health, my physical health, my relationships. Everything took a complete toll. We're a dumpster fire when I worked night shift. And I made this strict boundary with myself that said, for no amount of money will you work night shift. For no amount of money will you take a travel nurse contract that is all night shift. You will not do it. In my last travel contract, I was technically rotating day and night, and they never made me work night shift. I found myself eventually on the night schedule. I immediately was like, I have to find my way out. I did the shifts that I was scheduled for 3 weeks and I got out because I just cannot. And I've made that boundary with myself, and you have to do that for yourself. You have to look out for you because nobody else is going to. And I know we've all heard, you're just a number, you're expendable. If you died today, the hospital would put your job up on their career page. And that's amazing. I love that because guess what? That means I'm not carrying the whole institution on my back, and neither are you. So I think you should embrace that. You are just a number to them, and that's a good thing because if you weren't, if they were depending on you to function, that'd be a lot more pressure. So, yes, you are a number. You are expendable, which means you can leave. If it's not serving you, if it's not good for your health, they will be just fine without you. They will post your job and somebody else can take it because we're all different. We all have different wants. We have different needs. We have different levels of tolerances. We have different thresholds for things that we can handle. And I think it's important to know your threshold and to honor your threshold because you deserve that. You deserve peace. You deserve love. You deserve to be happy in your life and you deserve to not give yourself to this job, this system that you can't stand. And again, I just wanted to repeat myself that if it is something you love, if you love your job as a nurse at the bedside in the hospital, that's amazing. Like there are people that we need for those jobs, and that's great. Like if it gives you the life that you want, the schedule you want, the flexibility, like there's so many amazing things about working in a hospital setting that are huge pros. Like, if you work for somewhere that has great benefits and, the hospital I work for has a pension, like some people love that. Like they want the security of that. And they love that they can just work 3 12-hour shifts a week and they're good. But like, that's not the case for everybody. And so that's why I wanted to include this in this episode that your license is yours. You have the power to choose however you want to use that license and nobody else can make that decision for you. All right, Nurse Converse, I will leave you with that. All you nurses, healthcare workers, non-nurses, if you're listening to this and you're not a nurse, you're amazing for making it this far. Nursing students, I really hope that you gain something from this episode and that you really take the time to understand why you're doing what you're doing and define that for yourself, to understand your identity and who you are at your core. And then what are you doing to practice self-care and what matters the most to you? Like, what do you want most out of this life? And how can you get the most out of this life? It doesn't have to be this traditional nursing job. You're allowed to change your mind. You are valid for the feelings that you're having. And you don't need permission from anybody to make a decision to leave the bedside, to leave the hospital, or to go into the bedside, or go to the ER, go to the ICU. You don't need permission. You can make that decision for you for whatever feels best for you. So I'll leave you with that. My name's Colton Lord. Check me out on Instagram at ColtonLord17 or at Nurse Daddies on TikTok and Instagram. Check out my podcast. And thank you guys for listening. Hope you all have a beautiful day. See ya.